Thank you. I'm excited to be here with you this morning and look forward to this opportunity to spend the next 10 minutes talking about a very complex topic. Let me just tell you, healthcare, as we talk about change, is actually probably going to be in the next 10 years going through the most radical transformation of any industry. And many of you may be surprised or say, well, yeah, of course there's new technology, there's new innovation. The reason we have to go through a transformation is a little bit different, and I'm going to set the table here by sharing a couple of slides. This goes out over the next 50 years in the spirit of this conference and shows if no change happens, what's going to happen with the Medicare program. You can see the red line is the expenditures, the blue line is the income that will continue to come in. To make it a little more clear, let me just put it here in a more visible state. So here's Social Security by trillions. It is a little interesting to me how we've gotten comfortable as a society using that T word. It should be a swear word, but this is Social Security obligation. This is the total national debt, and then prepare yourself. This is the unfunded obligation for Medicare if we don't change where we're headed as a healthcare system in the United States. Now, I know this is Provo. I grew up here. My roots go deep in Utah County. I know even looking at that kind of debt makes us start to sweat around the country, and here we may have people have some heart palpitations. So let me calm you down just a little bit, and let's look at another slide. So this shows what we spent on healthcare. If you look at the left-hand side of that graph, you'll see thousands per capita spent on healthcare back in 1975. And then this is a quality metric. How long would you live for 15 years beyond the age of 45 for a certain percentage of the population, for women? You can see what 1975, you can see 2005, and it paints a pretty grim picture for the United States healthcare system. Not only have we not kept up with the rest of the world in our health status, that means we would need to move further along on the right-hand side, but our cost has just skyrocketed. It's gone out of sight. Now, the one positive is if Utah were its own country, this is where we would fit. Whoops. You can see right there, Utah comes right in with high quality, low cost. And I can show you slides and slide over and over to prove to you that Utah really is the lowest cost provider with the highest quality around the country. And there's many factors. We're a healthier population. We've figured out how to do utilization appropriately, and we think there's some attributable factors to the focus on healthcare that we've had from our physicians and the healthcare system just in general. Now, where is healthcare going to go into the future? Let me talk about a few things. How do we fix this next 10-year problem, and how do we prepare for what healthcare is going to be 50 years out? Well, one thing I can tell you is everybody is universal on one thing, and that's that we have to reduce utilization. There's about 20 factors. People are going to say we've got to get healthier. That's absolutely true. That's all going to contribute, though, to reducing utilization. There are things that happen that are unnecessary in the healthcare system, and you as a consumer sometimes don't always know what that is, or you've been marketed to so heavily that you feel like you have to have it. Let me give you some examples from history why we need to change. Back in the 1930s and 40s, when people had heart trouble, there was a procedure where they would do open heart surgery. They'd go in and they would clamp off a couple of the arteries going into the heart, and that would increase blood flow into another one. Similar to what we do in a cath lab now, but it was done a little more rudimentary that way. Well, we started studying it. It went on. The effects seemed to be positive. Did this for nearly 20 years. It became a very accepted procedure. You may have family members that had that done. Someone finally realized we needed to study it again and make sure the outcomes really were what we hoped they were. And they took a group of patients, did open heart surgery. On half the patients, they actually did the procedure. On the other half of the patients, they didn't do the procedure. They did the open heart, but they didn't clamp off the vessels. Well, they came out of it. Roughly 50% of the people who had the procedure felt like their heart pain had gone away, that they'd had an improvement. But the worst part of it is 80% that were not having the procedure done felt like their heart pain was improved, right? So that procedure was discontinued. We've also had incredible innovations in healthcare. Cataract surgery used to be a week-long stay in the hospital. We now go into basically almost like a dental office procedure. You stay for an hour and in some cases could be back to work that afternoon after a cataract surgery. So you're going to see procedures move out of hospitals and migrate towards outpatient settings more and more as we innovate. but there's also going to be a need for hospitals for the very sickest of our patient population. So for Utah County in particular, and then I'll move on with the last message I want to share, we think we're in an enviable position for the rest of the country and the rest of the world. Most importantly, because we have not, what we use a term in healthcare called overbedded. We haven't built too many beds in Utah like the rest of the country and frankly the rest of the world. When you look at how many beds per thousand that we have, we're on the very low end even for around the country. So as the population shifts from moving from an inpatient setting to an outpatient setting, we'll be well positioned to reconvert those beds. And as we do new construction, you'll basically see a hospital that's mostly ICU beds and a lot of the work being done in the outpatient setting. And we're already in a transition period to go that way. I have friends who run hospitals in communities our size. It would not be uncommon in the Midwest to see 2 or 3 hospitals the size of Utah Valley sitting in one area. And those folks are headed for some tough adjustments as the world of healthcare changes. Okay, so let me talk to you about the final thing, and that's what is your role as we transition into healthcare? Because I think all of us in hospitals and the physicians have been watching this trend come. We're nervous about it. We're anxious about it. We realize the world's going to change. It was the #1 issue in the political debate and will continue to be so as we go into the future. Well, there's an amount of change that needs to happen with us as patients. Let me give you one example. Our expectations as patients are really unrealistic. And let me just give you this story. So if you watched ER, remember the show ER, Chicago Hope, 911, any of these shows that you watched as a child, this was your expectation of what CPR could do for you. And if I polled you today, you'd probably feel that way. About 74% of you feel like CPR could save your life, right? Because you watched it on TV. Same people surveyed, 3% would leave you in a compromised state, and then to make the TV show dramatic, 23% actually passed away. Anyone have any clue what the reality is for CPR survival rates? 3%, right? Now, my EMT friends around will let me make sure, if you're one of those 3%, you want to make sure somebody knows CPR who's next to you. So we want to make sure we continue to learn. But it shows you our expectations are somewhat unrealistic. Let me show you another slide. This was a survey of a group of physicians who had lived their life as physicians, and so they had a pretty good feel for what they wanted and knew what could be done. If they had brain injury, and they were asked at the end of their career, so they were pretty seasoned about knowing what could be done. If they had a brain injury and they knew they were going to continue to live, but their brain function would never come back, they would not want any of these things done for them. That's what that slide basically says. Same survey of the general public, exactly opposite. As the general public, we want to do those kinds of things. Healthcare spends all of our dollars at the beginning and end of life, and sometimes in a futile effort. We have to change our expectations. We've got to be healthier, but we also have to be realistic about what healthcare can and can't do for us to fix it and for us to shape where the future of healthcare goes. In a nutshell here, Sir William Osler, who was the grandfather of internal medicine, founding member of Johns Hopkins, says medical care must be provided with utmost efficiency. To do less is a disservice to those we treat and an injustice to those we might have treated. And then I will tell you that we feel like we're on a pretty precarious path for the next 10 years. There are going to be many painful decisions that need to be made and little room for error. We believe in Utah, in Provo in particular, we are as well positioned as anybody to, over the next 10 years, set ourselves up beautifully for the future 50 years. But this is how it feels in our industry right now. Not a lot of room for error. So thank you so much for your time today.